Well, good afternoon, everybody, and welcome to this webinar bringing forward the new partnership between Rotary and Carers UK. My name is Amanda Watkin, and I am General Secretary for Rotary here in Great Britain and Ireland. I'm delighted that we're now able to work in partnership with Carers UK to raise the awareness of the increasing number of unpaid carers across Great Britain and Ireland and the value that they bring to society. Rotary, of course, is a network of 42,000 people in this region, and they're all embedded within the fabric of their communities. To be able to support those in caring roles through the Rotary network completely reflects our shared values and desire to make a difference. Thank you for joining the webinar today to hear in detail about this recently launched partnership between Carers UK and Rotary. During the webinar, you will hear from volunteer and staff colleagues supporting the partnership, and I know they would love to take your questions. We're in a webinar setting rather than a meeting setting to accommodate the over 200 registered people and over 150 people that have actually made it online right now. Within your Zoom controls, you should be able to find a Q&A, a question and answers button. And it's that area that I'd like you to use to ask questions of the panel members as we progress. I can see some people have put some comments into the chat box. That's absolutely fine. But it's the Q&A where we'll actually pick up the real questions that you might have in relation to this working relationship. Once the presentations are complete, I'll be posing those questions that you've set, or as many as we can accommodate in the time, to our experienced panel, which is a team comprised of Cheryl Berry, who's our project lead for Rotary, supported by staff team member Emma Howell, and Megan Over, who's Community and Events Officer for Carers UK, and Laura Doughty, who is the Director of Fundraising and Communications. We're also joined today by Norman Phillips, who is a long-term carer, a member of Carers UK, and we'll be hearing Norman's story a little later. So for now, I'd like to hand over to Laura of Carers UK to say a few words. Laura.
Thanks, Amanda. I just really wanted to add my thanks to the Rotary Great Britain and Ireland for entering into this 12-month partnership with us at Carers UK. I know I talk on behalf of everyone at Carers UK when I say that we are truly excited about the potential of reaching many more carers through working in partnership with all of you. Right from the beginning of our conversations and discussions, I referenced the enviable networks that you all have within your communities right across the country. Our Chief Executive, Helen, who sadly can't be with us today and sends her apologies, was saying right from the beginning that she recognised the benefit of the organisations working together because of our shared values and community support. But she also pointed out that as well as amplifying our voice, that many of you Rotarians would also be carers. We know that on average, carers take 2 years to recognise themselves as such. Many people simply think that they are a husband, wife, daughter, friend, when in fact you can be all of those things and a carer too. Now, we'll be running a poll that hopefully will be up on your screen sometime soon that actually is about whether you identify as a carer. Please help us today by completing that when you can, and I'll come back to that a little bit later on. But for now, I'm just going to pass back to Amanda to just highlight some of the goals of the partnership.
Thanks very much, Laura. And just to let you know that the polling is not necessarily going our way today. So what we might do is just do a little bit of a review with people through the chat box and through the question and answer a little bit later on as we progress. So we'll see where we go with that one. So just to say, this slide really represents the purpose of our partnership, which is to work together to achieve greater knowledge by the general public of Rotary Great Britain and Ireland and Carers UK, highlighting the important work of both our organisations within the community, supporting society as a whole. The partnership seeks to create Carers UK ambassadors within Rotary on a local level to raise awareness directly within clubs or districts. And importantly, Carers UK will be providing training for these ambassadors. Our synergy is clear. with shared values of supporting others, using the incredible voluntary work of Rotarians to support those in need, and supporting carers within Rotary clubs and communities. This is an exciting opportunity that will make a difference. I'd like to pass back now to Laura to continue the story.
Thanks again, Amanda. So our partnership, as Amanda mentioned there, is all about raising awareness of carers and caring, supporting carers to access the help and support that is vital to them. Carers are often referred to as the hidden army, but how do their friends really see them? We made this short film with our partners at British Gas to highlight this. I'll let the film speak for itself.
Show you how it works, if that's okay.
Sure.
Yeah. Sure. So you're going to see me on the screen here, and you're going to see my face, and you're just basically talking to me.
Yeah. Yes.
All right.
You might just have to keep it on because.
Okay, so that's how it all works.
Oh,
Look, I was going to say, I can imagine.
I was expecting this to be a mirror to myself. I would describe myself as bubbly.
She's really caring and she's really chatty.
I love dancing. Dancing's my thing.
She's fun.
She's just so well put together.
I try to always put on a sunny face, I guess.
Would you like an impression?
Hello, how is everyone?
He's very sweet, very, very sweet and very caring, very kind.
Anxious.
She's a very vivacious character.
There are dark days,
Most of the time she's happy.
Sometimes I feel extremely low.
Joyous.
Heavy. Yeah.
Very thoughtful, very caring person. He's really lovely.
Honestly, I'm kind of sick of it all. And it's hard for me to say, but there comes a point where you just stop kind of caring as much.
Yeah, I think she's pretty open.
I still don't open up about a relationship. I don't open up about my mental health. I don't open up really about anything.
Does it ever feel that talking to someone might help?
Sometimes I feel like it might, but I struggle to open up to people. I've just built this brigade of walls that I don't know how I feel about actually opening up to someone in depth. I don't want to burden them when I don't have to.
I've spent how many years as a kid, and I felt like they've been taken away. And now, even when I'm 20 and I'm just making my way into adulthood, I feel like it's still affecting me quite a lot.
Thinking, oh, no one understands me, feeling very alone.
Feeling very, just on my own.
Oh, I love you so much. Very much.
Like I'm such a bad friend.
No, you're not. You're
I just
not.
felt like if you wanted to talk to me about it, you would.
No.
And
It's a hard topic.
I know. Did you see my impression of you?
Hello.
Thanks, Meg. And I'm sure, although I can't obviously see you all, I'm sure that for many of you that actually that brought, certainly a lump to your throat. And I think that the thing about that video for me, which incidentally that film has gone on to win many awards, I think the thing about it for me is that it actually shows, you know, it's called Two Sides of the Same Story, Share That You Care. And it actually is about knowing if we reach out to carers, if we support carers and get them to be able to speak about their feelings, how powerful that is and the benefit that it has to them. That film is actually available on YouTube, so if you wanted to look at it again or indeed share it with your networks, please do so. In fact, we probably will have it as part of the toolkit to enable the volunteers to do some of their work. So as this slide here says, and as that film ended on, the last census, which was conducted nearly 10 years ago now, in 2011, the last census identified that there are 6.5 million people in the UK caring unpaid for a friend or a family member. And as that slide says, that's 1 in 8 of us. Now, that's a huge number of people who are providing that support unpaid, as I said. And if they were to suddenly disappear overnight, I think we can all imagine the massive hole that would be left there. Well, fortunately for us and the people they care for, I don't think that they will be doing that. But that doesn't mean that we shouldn't be seeking through the work of Carers UK and through our partnership to improve the life for carers. The amount of money unpaid carers save the national purse is £132 billion a year. That is the equivalent to a second NHS. But as I mentioned, that was actually taken from the last census nearly 10 years ago. And now we are in a different time. Before this terrible pandemic that we are still living in at the moment hit and impacted on all of us, even before that, our own polling suggested that that 6.5 million figure had gone to closer to about 9 million, 9.1 million people we were estimating were caring unpaid in the UK. But obviously the impact of the coronavirus has been massive on everybody's life. And we now estimate that that figure has increased to a huge 13.6 million people. That is in fact 1 in 4 people who will be providing care unpaid for across the country. And I think we can all think about how that figure has risen so much as a consequence of the coronavirus. Now, Carers UK, throughout the course of any year, we always conduct a lot of research. The reason we conduct our research is so that we can so we can quantify and know the real picture, obviously, but so that we can ask either government or other bodies to make changes and we can evidence the change that we need. This year has been no different in terms of the research that we've conducted, apart from one big difference is that we've conducted more of it because of the times that we're living in. So we know now, for example, in research that we conducted at the beginning of the coronavirus, that 70% of carers are now providing more care than they were before coronavirus. And on average, they're providing 10 hours more a week. Well, again, I think that we can all very easily be able to see the impact that that is going to have on somebody's physical and mental health. So it's unsurprising to me that 70% of those people said that it is having a negative impact. The extra care is having a negative impact on their general health and well-being. We absolutely know that it's as a consequence of support services not being able to provide that support during this time, because people were restricted to their own homes, other support agencies, or indeed friends and family members were unable to come in and to provide that respite. And of course, people were unable to go to work. And for some, going to work in itself actually does provide some respite. So the situation for carers during this pandemic has gone from bad to extreme. So we've got a lot more research that's coming out later on this year, because as we come out of it and as furlough, for many people who are on furlough, as that comes to an end, we want to make sure that carers are supported in every way possible to be able, for them to be able to access the support services that actually have been put on hold across the country. So we are, I talk about across the country, so in terms of who we are as an organisation, and again, many of you already know this, we have offices in Belfast, in Cardiff, in Glasgow and in London, where our head office is. We don't have on-the-ground support. We do have national support. So we are the leading national organisation for unpaid carers. So we have a national helpline and email support service. And of course, we have our support through our website and all the other information that is available there to be able to support carers. We work predominantly with carers over the age of 18, and some people have asked about our relationship with Carers Trust. We do work closely with Carers Trust in many areas. Carers Week, for example, they are one of the charity partners that we work alongside. Excuse me. We also work with them actually in delivering some contracts with government, but where we specialise in carers over the age of 18, they actually do represent and help to support young carers. And our focus would, we let them do that, and our focus would be on working carers. So in summary, Carers UK is the leading national organisation for unpaid carers. We give expert advice, support and information. Our reason for being is that no one has to care alone. Through our forum, our online forum, that is one way that we help to connect carers through peer support. But we really are about making life better for carers in the long term. So through our research and advocacy, we champion carers and seek to change the law. For example, one of the things we've done most recently was present a letter to the Secretary of State at the Department of Work and Pensions, where we have asked for the carers allowance to be increased. It is the lowest allowance of all its kind. And so it's unsurprising to us that carers are actually financially finding themselves struggling at the moment. So I'm now going to pass over to Meg, who will introduce Norman.
Thank you very much, Laura. So I'd like to welcome Norman. As Amanda mentioned earlier, Norman is a long-term carer, also a member of Carers UK and one of our fantastic volunteers based in Stevenage who helps us reach and connect carers across the UK. Norman is going to be sharing with us a little bit about his caring experience, the impact the COVID-19 pandemic has had on his caring role, and a little bit about his volunteer work and the support he's received from Carers UK. Norman, over to you.
Good afternoon. My name's Norman Phillips and I'm 68 years of age. And that lovely picture that Meg just showed you is the person I am today. 12 months ago, I weighed 30 stone. So I've had surgery, so I'm a bit less than I was. Anyway, I care for my wife, Ros, who has MS, secondary progressive MS, and is non-ambulatory and has dementia as a result of the brain damage. I also look after Mum, who has Alzheimer's and vascular dementia. I've been a full-time carer since 2008, when I took early retirement, because I collapsed with significant physical and mental health issues as a result of trying to provide care for my wife and to continue working. My role was as a program manager with Fujitsu, working on the patient's record system, and that was probably enough to drive anyone nuts anyway. Anyway, I took early retirement. Then in 2017, I found that trying to look after Rosie in Stevenage and Mum in London became even more challenging. Mum kept ending up in hospital because she did daft things. So I managed to persuade her to move to Stevenage, and she lives in her own flat, one of these McCartney Stone places. Rosie and I live in an extra care facility because as a consequence of taking early retirement and some other issues, we lost our home. So we were rehoused in this extra care facility. So we have 4 planned visits a day from care workers, and then in emergency, I can get help. The reason for that is I had a very bad car accident and I've ended up with scoliosis of the spine, so I can no longer do the manual handling. My day starts at 7 o'clock when I do the meds and continues until we settle Rosie about 10 o'clock. Other than the 2.5 hours a day for the planned visit by care workers, I do all the domestic stuff, medication, shopping, cleaning, managing the finances, etc., etc. In addition, I try to ensure Ros does some exercise every day. and I need constantly to prompt her to drink to avoid dehydration and what they call UTIs. She's only just recently been in hospital because the struggle to get her to drink and to follow any kind of pattern I fail at regularly. Unfortunately, the brain damage in Ros from her MS means she functions as a 3 to 5 year old and behaves accordingly. So you imagine, I've got a 70-year-old toddler. She's a lovely lady, but she can be a grade A pain. Right. One of the biggest challenges as a carer in trying to motivate her and get her to do things is she still sees me as husband, therefore it's someone telling her what to do. Because as an unfortunate side effect of COVID, the support we used to get in to motivate her, that's all disappeared. So I'm now left in the situation of being parent, husband, and motivator. And I get told quite often where to go, and the word usually begins with an F. When COVID struck, I made a decision to move Mum in with us because, as I say, Mum suffers with Alzheimer's and vascular dementia. And because Rosie was a shielded person, I could not be in 2 places at once. So we made the decision with the council's permission to move Mum in here. It's been quite challenging because both of them having dementia, they reassemble the world in a way that suits their memory, which isn't always current. So they do butt heads quite often, and you end up as making the Solomon judgments between the 2 of them. It is now 12 months since I've had a break. I used to get a break every 4 months for 2 weeks, in addition to 15 hours a week of respite when someone would come in so I could go and chill out. But that's all been stopped. So I've been on the front line now for 12 months. And to be honest with you, I am very tired. And I did have a mega meltdown in March, April, which required some mental health help. I had some counselling. Also, because life moves on, I was diagnosed with cancer in January. They did some surgery and they said they've cleared the cancer, but they can't complete the treatment because of COVID. And one of the things you begin to realise as a carer is you can't land that on your loved ones because they wouldn't understand. So again, there's no one to talk to, at least there wasn't. But now with Carers UK, I regularly join in Care for a Cuppa. And it's where carers can come together and actually talk about things and talk about the dark things that worry us. And because if you get a bunch of carers together who are chatting, we'd probably be arrested if they actually were to play that in public, because it can be dark times and you do need to vent some tension. My involvement with Carers UK started in 2010 when I reached a crisis point. In common with most carers, I didn't know that there was help out there. No one was telling me. My doctor didn't tell me. No one told me. I just thought I was failing. I got in touch with Carers UK through a friend, someone who knew them. From there, I got signposted to a lot of events. And then because of my background as a project manager, I found I could make use of my skills helping campaign and do a number of other things. This year, as part of Carers Week, I had the bright idea of walking for 26 days, 2.6 miles a day with 4 carer champions. And we managed to raise £3,000 for Carers UK, Carers in Hearts and Crossroads. Since we started our Carers Walk, which has now gone on for 5 years, we've raised over £20,000. And our local Rotarians in Stevenage have helped. On occasions, we run into some problems where we can't fund up front to kick it off. So the Rotarians in Stevenage have always been very generous. They've paid for insurances for us and done a number of other things. In terms of Carers UK, besides Care for a Cuppa, I do go on the forum, and you'd be surprised how many carers are on the forum at 2, 3, 4 o'clock in the morning when you can't sleep. Because one of the challenges I find is my wife wakes up in the night. She's like a toddler, so she wakes up. She wakes me up, usually by pressing her alarm, which then sets all sorts of things in motion. And we end up with wardens coming in through the door. and then you end up being awake for hours on end because you can't get back to sleep. Unpaid caring is a challenge, but with support it can be done. And if we could get enough support out there earlier and get to carers much earlier, not wait 2 years, or encourage carers not to wait 2 years, then a lot of the problems and a lot of the ill health and everything else that comes with it could be avoided. But we need to empower carers. And one of the things I've been campaigning for with the local authority is to listen to what we need, not tell us what we can have. And we're beginning to win that argument. So that's my story. And I'll hand back to Amanda.
Thanks, Norman. We're actually going to hand you back to Emma.
Oh, Emma, sorry.
No, not a problem, Norman. That was amazing to hear your story. Thank you so much. Emma, over to you.
Hi, that was a really inspiring story. Thank you, Norman. My name's Emma Howell. I'm the Corporate Sales and Marketing Manager for Rotary, and I've been working with Megan at Carers UK on this partnership and working out the goals and processes that will follow over the next 12 months. Our aim is to give Rotarians a hands-on opportunity to get involved with this project. It's very much about identifying unpaid carers who may need help in your communities and doing what Rotary does best, which is making a difference, showing them what help is available to them and offering support through our partnership with Carers UK. There will also be a chance, as Amanda mentioned earlier, to get involved by taking on roles of a district lead or a Rotary / Carers UK ambassador, and we will talk a bit more about that later on. So the goals really are getting as many Rotarians involved in this as possible, supporting unpaid carers across the UK and spreading the word, which will raise the profile and highlight the important work of both organisations. So I'm going to hand over to Megan now because she'll talk a bit more about the goals for Carers UK.
Thank you very much, Emma. So as Emma said, me and Emma have been working together to build this partnership over the last couple of months. And I'm just going to talk a little bit about the goals of the partnership from a Carers UK perspective. But what I would really like to do is echo what Laura said earlier, that this partnership is an incredible opportunity for us at Carers UK to be able to work with Rotary, to utilise our synergy and our want to support people within communities to raise awareness for carers. So firstly, raise awareness for carers. Within Rotary, there will be so many Rotarians, as we mentioned earlier, who will be carers and not recognise they're a carer, or may in the future become carers. And then raise awareness for carers within the communities Rotary works. By working with Rotary, we will be able to reach more carers across all 4 nations of the UK. Through this, we can then raise awareness for the work we do to support carers. As Laura mentioned earlier, this is directing carers to our support, information and advice services, our helpline, which is open 5 days a week. As Norman mentioned, our forum, having this peer support forum to be able to support carers 24/7. And also to be able to direct carers to become members of Carers UK, to join our carers movement, to have their voice heard and to be able to connect with other carers across the UK. And then another big focus for us is to be able to build our volunteer workforce, be able to work through the Rotary GB&I and Carers UK ambassador role to be able to reach and connect more carers across the UK so we can follow our aims of making sure that no one has to care alone. I'm now going to be passing over to Cheryl, who's going to be talking a little bit more in detail about how we're going to be developing the partnership across the UK. Thank you, Cheryl.
Hi everyone, I'm Cheryl Berry. I'm a Rotarian and a carer. As a Rotarian, I was District Governor for District 1220, and I'm now the co-team leader with Bill Campbell for the Humanitarian Services team of Rotary Great Britain and Ireland. As a carer, I've been a carer for my husband for several years, and I have been so very grateful to Rotary and my Rotary friends for their support, because it can be a very lonely thing at times. And as you can see, what we've done to develop our partnership is we've got people from Scotland and Northern Ireland and Wales who we're calling our nation leads. Mark Davidson has very kindly volunteered to do Northern Ireland. Mark is very enthusiastic and committed, and he's from the Belfast Rotary Club. In Scotland, David Fryer, again, is keen to work with all his districts in Scotland. And David is the chair of community services for District 1010. And finally, in the team from Wales is Peter Hamilton. Peter is a past district governor for 1150. And Peter, again, has worked with carers in Wales for a considerable time and for the UK network. So the four of us will be working as a team and linking with our counterparts in Carers UK. And our main aim to begin with is establishing communication and support networks to link clubs and districts to the UK and Carers UK network. So if I talk a little bit next about the actual district leads, because for it to work, we need all the districts to be able to get easily involved with things. So what we're looking for is for each district to have a lead to promote the work of Carers UK within your district, encourage Rotarians to sign up as what we're going to tell you a little bit more about, the Rotary GB&I Carers UK ambassadors, to coordinate Rotary GB&I Carers UK ambassadors in your district, and to share with Carers UK opportunities to be involved in events within your district, and to share your activities with your relevant national lead. So that key role of a district lead is an engaging one, a two-way relationship between what's happening in your district and what things can be provided for you. If we move on a little bit further to look at the next role, this is the one, and I love the picture because it absolutely is. Say a picture paints 1,000 words, and it is like someone's heart in your hands. As Norman has said, and I've tried to explain briefly, things can be so lonely, and just somebody caring about you makes an enormous difference. So what these ambassadors will be doing is increase awareness of caring and Carers UK across Great Britain, connecting the carers themselves with information, advice and support. Often people are totally unaware of what they can avail themselves of, and to increase membership of Carers UK through our fantastic Rotary active membership and networks. The partnership is such a good thing for both organisations. We both care, we both want to help as many individuals and communities as we can. Now there's a diagram that shows you a little bit how we envisage it. I apologise, it's not a large diagram, and basically it's a two-way between, and we put the ambassadors at the top. This is correctly, in our opinion, the ambassadors are the key, they're on the ground. The ambassadors to their district leads, to their nation leads, and then to the Rotary GB&I partnership team. Then the second diagram is slightly different, and I suppose shows the strategic partnership between Rotary and Carers UK in terms of how the partnership team at Rotary will work with Carers UK. And then you'll notice Carers Wales, Carers Scotland, Carers Northern Ireland, Carers UK, because of the different structures we'll be working, and our nation leads will be a key thing in that. And then most importantly, if I finally share with you, how can you get involved? We hope this webinar this afternoon has inspired you, if you weren't already, to say, we can do something about this. We can help the carers in our area. So how can you do it? Register your interest to be a district lead or a Rotary GB&I Carers UK ambassador. You go to the Rotary website, the members area, Carers UK partnership. So if you go on there, There's information leaflets for you, and there's information about how you can get involved with one or other of those roles. And then we are planning further webinars in August. So there'll be one for Scotland, one for Wales, one for Northern Ireland, one for England. And we'll be in that focusing more on the kind of relevance perhaps to your particular part of the UK. So we're going to be working together, national leads, Carers UK, and then we'll send information to all of you as quickly as possible about how to join a national webinar. So a huge thank you for coming along this afternoon. We're really pleased at the interest that's being shown. And I'm going to hand you back to Laura now for the question and answer session. Laura?
Thanks very much, Shelda, and thanks for describing how well that the partnership is going to work. I think it's going to be very exciting, as referenced earlier. What I was hoping to do now was actually to be able to do the poll thing again, but obviously we don't have the poll this time. I'm sure there's a way that we can figure it out. But in terms of the Q&As, then of course there'll be questions that will be directed towards us at Carers UK, but also towards Rotary Great Britain and Ireland representatives. So I think, Emma, were you going to be managing the questions in terms of how this part was going to work?
I believe I was going to be called upon if there was questions connected to Rotary side, which I know I've just had a quick look at the questions, and just to answer a couple of them in one go, we will be sending out information to everybody who registered today. We will be sending out a follow-up email with the link to the webinar, which has been recorded, so that you can look back on this material, and also a link to the to register your interest for the roles that we've talked about as well. We are in the process of producing some leaflets, as was mentioned, and we will follow up with the specific role descriptions and the leaflets very shortly. So just wanted to, I know lots of people were saying, where can they get more information? So I just clear that up.
Okay, I'll just answer a couple, but obviously other people can come in. In terms of scrolling down some of the Q&As, one of Stuart Ross is part of the problem during the crisis. The NHS is closed to everybody except COVID patients. Well, I think that's had a profound effect on everybody. So probably that has contributed. Yes, I think that if you think about how a lot of people are providing unpaid care, and Norman referenced quite a lot of it then, it's actually the support of people either coming into the home, that could be paid care workers to come in and support unpaid carers, but also people perhaps who are going to community settings. So Norman, I don't know whether your mums sometimes actually would go to a community setting, a day centre or something, for example, but obviously they have been closed down during this COVID coronavirus pandemic as well. So there's lots of reasons for it, and obviously when people are having to shield, I mean, isolate is one thing, but shield is another thing. So not having anybody come into the home, that certainly had a massive impact on it.
One of the big issues, having had conversations with Herts County Council, is they've not been able to keep up with the backlog. So as the number of people needing care support has grown, carer support, they just don't have the resources to pick it up. So they've got a huge bow wave of new demand, plus loads of people like us who have been cooped up for 4 months. And how do you go back to normality? So there's a real big challenge coming as to how you bring people back into life. How do you start the day centres again, etc.
Yeah, that's a massive challenge. And, really us at Carers UK, a large part of what we're about is making sure that at every step of this, and I don't really like to use the word normalisation of, getting us all back to normal life, but at every step of that carers aren't forgotten, because sometimes we can be relied upon, can't we, as carers, to just, well, they'll pick up the pieces. And, you know, well, whilst we can be relied upon, we don't want to get to a breaking point, as Norman far more eloquently put it than I did. You know, Veronica mentioned the fact that there used to be services provided in her local area and they aren't there anymore, and who is providing those? Well, unfortunately, Veronica, I don't think anybody is providing them. So again, that is why the awareness of what Carers UK is able to do from that emotional support point of view is really important. So we do have our forum. Again, as Norman mentioned, unsurprising, a lot of carers are on it in the wee hours when perhaps the person they're caring for has gone to sleep. But we also, later on this year, we're going to be relaunching, because we used to have this service, but we've, like everybody, we rely on funding. So we've been successful in getting additional funding, and later on this year, we will be relaunching our listening ear, a listening support service. And that very much is to provide that emotional support to people. Our helpline, which is now open 5 days a week, 9 hours a day, and before the pandemic, it was 6 hours a day, just for 2 days a week. Our helpline actually is much more designed to help people with practical support, i.e. how they can access maybe its benefits, for example, or maybe something to do with housing, or how to start a conversation about flexible working if they're returning to work, all of those sorts of things. But we have seen a very big increase in people simply wanting that emotional support. You know, caring on average for 10 hours more a week, as I pointed out, of course that emotional support is going to be important. So I'm delighted that that's going to be coming online later on again this year, and I have a feeling that that's going to fly. So we'll look out for that. What does Carers UK expect of Rotarians, funding, hands-on, etc.? Okay, so my job title is fundraising and communications director. So basically, I'm always going to say, oh yes, well, please help us raise money. But actually, this relationship for me is, I have to say, it's not about the money, but please do give us money. It's not about the money. It is about absolutely raising the awareness. So it's about that, as I mentioned earlier, it's an enviable network that you have at that local level. So people that you speak to, who you can tell they can get this support, and also within within the Rotarians themselves, many of you, that's why it would be great to see that poll. We'd be able to do it another time. You know, maybe some of you are sitting there now thinking, gosh, I didn't realize I was a carer. I just thought that I was providing care for my husband. But of course, if I didn't do it, as Cheryl referenced, you know, who else is going to? So yeah, you are a carer as well as a wife, or a husband. You know, so for us, it's very important about that, raising the awareness within those local communities, so that people come to us and get the answers that they actually need.
Yeah, Laura, sorry to jump in there. Somebody else has asked the question and said, how do we find and how do we identify these people in the communities? I think there's lots of ways you can do that. Obviously, we're going to offer training to people who want to be ambassadors, so that you'll be given training by Carers UK for that. You'll also be given lots of tools that we can use, so leaflets and things like that you can use in your local community. And when the world is a bit more normal, there'll be events that you may be able to hold, pop-up events, etc., where you can highlight this partnership as well. But I know the world isn't quite normal at the moment, but we will provide you with all the tools that we can to use on a local level for you to spread the word.
Yeah, thank you, Emma. And I wanted to just add in there, it's fantastic to see both in the chat box and the question and answer box as well, so many Rotarians sharing the services they already provide to support carers within their area, and it's fantastic. The feedback we received after announcing the partnership, and again, Rotarians getting in contact saying, we do this to support carers in our area, is fantastic. So by the ambassador role, we can link all of this together, link to reaching out to connect local carers, and we will provide training in order to do that, and also link to the services that Rotary are providing and put these together in synergy, so then we could provide a whole experience to support carers.
Cheryl, if I can do. Cheryl, we've got a question from Robert, who says, will the district lead contact individual clubs within their district? So do you want to just talk a little bit about that?
Yes, please, that would be wonderful. And I'd also picked up a question that said, how quickly are we getting district leads? So if I can start off by saying we hope that people will respond to the web reference, and we can pick that up as soon as possible. With the district leads, yes, we will want to work with you as the Nation Leads team to then contact your clubs. And wearing my Humanities Services team hat, we'll be using the newsletter, we'll be using our other communication structures as well to encourage the clubs to get involved. And what I found fantastic scrolling through just now, your Q&A, are the number of activities that are already happening. So it's really highlighting superb good practice already out there, and it'll be sharing it. The district leads with the clubs and the ambassadors will be able to share what's happening and make a bigger picture for the carers as well.
Could I just say something? As a carer volunteer, to stop reinventing the wheel, there's lots of us out here which have got lots of contacts. So I, for one, would be more than willing to help anyone in Stevenage or Hertfordshire to get them onto my, show them my contacts and make those introductions. Because I can't get round everyone. So if there's more people willing to get round, great. And I don't need to lead it. I'm quite happy to stand at the back.
Thank
that
you.
would be lovely.
And we did as well, we announced it in our volunteer newsletter, which went out to all Carers UK volunteers. And we've already had, again, offers from Carers UK volunteers who are really eager to support the partnership from their side. So I think the idea of being able to connect Carers UK current volunteers and then Rotary volunteers will be so useful for again to combine your local knowledge and be able to reach a higher number of carers. So definitely, Norman, thank you.
Just so you understand the size of the challenge, in Stevenage, there are, according to the census, 11,000 carers, and only 4,000 are getting help. Yeah, so that's just one little town. It's a huge challenge.
Definitely, thank you, Norman. I was just going to pick up, I know there's a couple of questions in the chat box talking specifically about Northern Ireland, and I think from Michael, and there's also another one about Wales. These questions would be fantastic if you'd be able to bring them to the nation-specific webinar. In the nation-specific webinar for Wales, Scotland and Northern Ireland, we're going to have each of our carers teams based there. They will then go into more detail about the support services they provide within those areas, and they will also be able to answer some of your specific questions about pensions and how the services change in each of the different nations.
Just on that point, Meg, just the question about carers allowance and receiving, and it ceases once your pension kicks in. Carers allowance, as I mentioned, is the lowest benefit of its kind, and it's the most cliff-edged. You have to work for 35 hours. Oh, sorry, you have to care for 35 hours a week to even qualify for it. And then when you start getting another income, as I say, it's kind of cliff edged, and that other income could be pension. It's a whole big minefield, but it's a massive campaign for us, our Fairer for Carers campaign, to make sure that we get an increase in the carers allowance. It's more in Scotland, so the very least that we would want would be for it to be the same as it is actually in Scotland. And that's just an important point to make in terms of, obviously with the devolved nations there can sometimes be a difference, and that would be one of them, and probably in fact the most significant one. The other thing that I would just say, I mean, there's quite a lot of questions on here which obviously we haven't answered all of them, but through the development of the materials that Meg's done with Emma, I think quite a lot of these questions would be answered in that. But I think that what we're not really expecting is for people to, somebody asked about GDPR. I think it's a lot of what we're expecting from this ambassadorial role is raising the awareness and signposting onto the services that are available. And again, just to mention Norman's case, that when he started caring, obviously he didn't even know that any of this support was out there. Nobody mentioned it to him. And then when he did know, then once you're in that, obviously then you can find the things yourself. So you know that Carers UK has, for example, the support forum and so on. So yeah, so I don't anticipate people going out and getting people's names and addresses and so on, more about raising that awareness and helping people to self-identify as well.
One of the questions that's come in is saying, will local carers UK groups know about this partnership? So if there's communication going out through the Carers UK channels to your members. Do you want to talk about that a little bit?
Yes, that's a good one. Thanks, Amanda. So yeah, so we are a membership organisation. We have not as many members as the Rotary, but getting there. So we've got just over 30,000 members across the country. They don't represent, they're not in individual groups per se. So our membership get communicated to regularly. We've already sent out, as I think people will know, we already sent out communication in Carers Week, which saw the launch of this partnership. And we subsequently have included information in member newsletters, which are monthly, and we've also got a member magazine which is going out shortly when there's reference to that. So hopefully it'll be a two-way thing. You know, hopefully some carers will absolutely want to become members of the Rotary Club as well. In terms of that local footprint, then there are people such as Norman who do things in a locality and who know each other. And can and are obviously supported in that way. And again, everybody knows about the partnership that we've got with Rotary. But it would be from a national membership point of view that the main communication would be going out. I'm just seeing if there's any other questions.
Whilst you're doing that, there's a comment come in from Sue Northrop. She says, our community emergency resilience team has been working with Rotary and others to support people in the community. Want to build on this. We've been shopping, prescriptions, good neighbours. Most services have gone, but a lot of phone online support is available. Cheryl, any comment that you'd like to add around that?
Yes, I would. I've been heavily involved with the Rotarian response to COVID. And one of the things that has worked so well has been our linking with the local resilience groups, because it's so important to make sure that we're reaching as many as we can by pooling resources and pooling skills and the networks. So I could see an awful lot of opportunities there. And looking at the Q&A, I know John Minnick has come in regarding Parkinson's UK. Because quite rightly, John and I had a chat the other day about linking what we're doing to some of the other caring organisations that specialise perhaps in other things. Norman mentioned with his own wife and mother, there are other illnesses, etc., that have support. And I could envisage that through resilience groups, through other charities, we can spread what we are doing. The more we work together, the better.
Thank you. Laura, did you find anything else in your little scroll through the questions?
Yeah, I mean, there are quite a lot. I mean, there's a question about whether about giving Norman's contact to somebody. What I would say is, if you send us your contact details, we'll pass them on to Norman. I know you're saying he's in your district, so I think that's probably the easiest thing actually to be able to do. And somebody mentioned about, it's not just about raising awareness, it's Rotary's about getting outcomes too. Well, I assure you, we're all about getting outcomes also, and we are monitoring throughout this whole partnership. We are absolutely monitoring against the KPIs and against the effectiveness of this. So rest assured. But that first thing about, if you don't know you're a carer, then you're not going to be able to, you're not going to seek getting support. So that's the first very positive step, I think. Our carers, sorry, I just saw this one here, sorry Amanda, are Carers UK working with local food banks? Well, that's a really good question. So, so what I would say about that, two things. We have been conducting some research with the University of Sheffield around sustainable care, and the most recent piece of research that we did with them showed that carers are twice as likely to be using food banks during this coronavirus pandemic as they were, you know, before. So that's a huge increase in carers accessing food banks. And we actually have done some work with the Trussell Trust. We have created a resource which goes out within the, it's a physical resource that goes out within their packs to say you can get support here. So food banks, food poverty and food poverty are a big issue for us, and are coming out time and again in a lot of our research, and also in calls to our helpline as well. So yeah, thank you for that question. Yeah,
if I could just add a little bit there, Laura. We have a project called Rotary for Food Banks that started in District 1220 and now is across a number of districts in Rotary, where we're providing a supply chain, a distribution food chain from Rotary donations through to the food banks, because we envisage this is going to be a long-term need as we come out of restrictions. And particularly here, our work with you as Carers UK, it's a sustainable project that we're working on. So I think it'll be music to the ears of a lot of our Rotary districts out there that are already working on this Rotary for Food Banks project.
Yeah, there's a lot of tie-up, isn't there, across many of the projects that Rotary's already involved in, and the need that exists within society. That's obviously the bread and butter of what Rotarians have been doing for decades now. One question that's come in says, is there a representative aware of this project in the government? I think the answer to that is that there is lobbying of government to try and get greater awareness of support that's required for carers, full stop, unpaid carers in this instance in particular. And certainly the relationship that Rotary has with NCVO, the National Council for Voluntary Organisations, and I suspect that Carers UK is also on that circuit as well. And our relationship with Carl Wilding, their CEO, we will definitely be supporting Carl's work to lobby the government to try and get this right, to rise above the parapet and onto the wider agendas. So the project, in terms of the relationship between Rotary and Carers UK, not necessarily something that would go straight into a government setting, but the work, the outcomes, the impact that's required, that is definitely a government agenda item. Okay, Laura, did you see anything else there you want to hook onto?
Meg, I'm going to ask Meg to be double eyes on this.
Of course, definitely. I was going to pick up on Sam Bell's question about. Oh no, sorry, I'm just popping through the chat box now just to make sure we've not missed anything.
While you're looking, Megan,
yeah.
Just a really quick one. Somebody else has asked if there can be individual Zoom calls with clubs. I think that would probably be too hard to organise. So what we're actually doing is, obviously we've done this webinar today, and then we're doing the individual nation webinars in each country, and we'll be providing all the tools. But for individual clubs, it would be too difficult to do that.
Another question that's come up, it says from Kath, she says, many of our members are over 70 years old. Does age matter? And I'm going to jump in straight there and say, no, it does not. Okay, this is about your desire and ability to be able to talk to somebody else, another human being, that human interaction. I think a fantastic example. We've got to just, give a shout out to Captain Sir Tom Moore and say, there he is, 100 years old. And I would say age does not matter. Anything to add to that, Megan, from your perspective?
I think you are completely right there. I think there is so much knowledge and experience no matter what age you are, and there is so much that we can work with in Rotarian, so there is definitely no age limit whatsoever.
Perfect, thank you.
I think from our side, there is a question there for Cheryl. Cheryl,
yes.
Carol Whiteley has asked, I could see this partnership linking with the work of health fairs.
Yeah, absolutely. I think it must have been a crystal ball or something, but Carol has just joined our humanities team. And in fact, we've got a team meeting tomorrow, and Carol is going to help us to do what we're calling health fairs, which would bring together groups of districts, and at those health fairs, rather like a kind of mini expo, we'd bring a number of organisations to showcase and to signpost what they do. And so Carol quite rightly put up on the screen, and I spotted it, to say, you know, Carers UK partnership would be a brilliant one. And we'd be bringing in like the Stroke Association, we'd be bringing in Parkinson's. It would be a wonderful opportunity, I think, to network and enable people to see the range of services available. So, you know, thanks to Carol, we have this great new idea in the pipeline, which we'll be talking about tomorrow morning. So, you know, well done, Carol. Thank you for pinging in the question.
And good also to see a comment in from Selwyn, who says, my club, Edgware and Stanmore, has initiated Rotary Safe Spaces for Carers, a project to help carers with regard to their mental health. And Norman openly touched upon this, how, you know, it can be, you know, really quite challenging environment. And I think to have that sort of psychotherapy, counsellor support is essential. So great to see that this is happening already, and we can build upon this going forwards. Okay, so individual clubs we covered. Okay, so we've got, is there a database of activities and events so that Rotary can work towards healthier lifestyles through involvement of local sports centres, social environments, etc.? And that comes in from Tony. So do we think that we can get hooked up somehow, Cheryl, and probably Megan as well?
I think so, yeah.
Activities.
I think so. You know, we touched a minute ago on this idea of health fairs and providing a kind of directory of what's available. My mind was working overtime just then, thinking there's no reason to stop at that. We could have an online sort of directory, so people could easily, the idea is to make it easy for a carer to get that information. And I think an online directory would work very well.
Definitely. And I think from our perspective at Carers UK, very much having the activities and events, obviously when we know more what's happening with the COVID-19 pandemic, and if we can do in person, but currently focusing on virtual, that is a big focus for us to have these activities and events to connect Rotarians, to connect carers across the UK, and that will be a vital part of the partnership.
Wonderful. And Kenneth just put a comment in, really important this actually. He says, please don't forget those carers who are hard of hearing or those that they're caring for might have hearing difficulty as well. Southsea Castle is doing a sign language project within Portsmouth and Hampshire. It's about to resume soon, all being well. Obviously, COVID's put the sort of the damper on that for a little bit, but he's happy also to chat to this about anyone, and he's a current and a past carer. So yeah, important that we recognise all the wealth of need that might exist for an individual. So thanks for sharing that. A lot coming in on the food banks, saying, you know, fantastic sums of money being given to the local food banks. As Cheryl said, you know, this has been a major project throughout the COVID response, and it is one of those that will continue way beyond COVID response as well, as unfortunately food poverty continues to affect so many people within society.
Could I just come back on the hearing, Amanda?
Of course.
We have Rotary Hearing Ambassadors that have been in existence now a couple of years, and we hope at the beginning of August to launch the website. So there'll be that information that I can put out through this network. But the Rotary Hearing Ambassadors have done quite a lot already, and particularly because we're Zooming at the moment, and you can forget that people with hearing difficulties, you've got to think more carefully about the message. So there's a lot of work already done, and the Rotary Hearing Ambassadors, I can alert them to this afternoon.
That's great. And Mary also says, don't forget carers with visual impairment as well. Again, so we need to just be conscious of all requirements. Peter Hamilton's put in an answer to the question that was raised earlier about the club Zoom meetings. He says, answer, nation and district leads can arrange their own Zooms with clubs. So I think further down the pathway, once those district and nation leads get themselves established, I think they'll be able to pick up some of the slack that from a central position would be just too overwhelming for us to handle. So thanks for that, Peter. Much appreciated.
I just want to come in on a question, I think it's in the chat box from Hazel Brindle, who said, is there any restriction on the number of ambassadors in any club? And there is no limit on the number of ambassadors. I think, as Norman said earlier, the number of carers we are trying to reach in an area and the number of carers who currently have support, the more ambassadors, the better. The more ambassadors we can get to work within a local area to reach and connect even more carers, it would just be fantastic. So there is no restrictions.
Okay, I think we've probably covered, because there's a lot of similar questions that are sitting in the question panel as well. So what we will do is we'll draw all of this information out and try and put it in to start to build an FAQ. I think is where we'll probably go from this as we move forward. So so yeah, I think really just to ask Laura, have you any sort of final insights that you'd like to offer up to our participants today?
Yeah, thank you, Amanda. I think a Q&A is a really good idea for us to put that together. I'm really delighted that there are so many questions. It shows that the appetite to engage with this partnership is really there, and it absolutely shows that this ambassadorial role will be shaped by the individual need within your communities. You know, Carers UK, it's, you know, we're for all carers, so there's no condition specific thing, and so therefore that inclusive nature of all carers, regardless of age or indeed themselves of their own disabilities or the condition of the person that they're caring for, is really important. But the fact that I just want to leave you with is, if 13.6 million people are caring unpaid in the UK, that does mean 1 in 4 of us are. So we don't have that number of people who are our members. So there are a lot of people out there who are desperately in need of that support. And I believe that with this partnership, the Rotarians will reach them. So thank you in advance.
That's amazing. Thank you so much, Laura. That's just great. And I'd like to just give a big thank you to all of our panelists that have been working on this project today, to Megan, Cheryl, Emma, Laura, of course, and not forgetting Norman. What a delight it has been to meet you today, and thank you for sharing so openly your story with us, Norman. So very much appreciated.
You're more than welcome.
Thank you so much indeed. And to everybody that's stayed online, we had over 160 people throughout the course of today, and we know over 230 actually signed up. Not everybody can always make it, but we'll be sharing all of the resources, as Emma said, so the webinar link, and we'll be putting together this Q&A system as well. So thank you so much for your active participation, and we're now going to let you leave and get on with the rest of your day. And thank you once again for getting involved in this project and for being part of Rotary and part of Rotary's future with this partnership with Carers UK. Thank you very much indeed.